Hi everyone, this is Dr. Karamachi, Dr. K for short, from Integrated Therapeutics. Thanks for listening to this video. Today I want to talk about the most common cancer that people experience. It is lung cancer, if you don't know. So lung cancer is becoming more and more common in the States and also across the world. There was a lot of smoking 50 years ago. It has gone down significantly now. People do more drinking than smoking now. But you can still have secondhand smoke exposure for lung cancer. They say around 80% of lung cancer can be caused or be related to smoking. So we offer different kinds of treatments for people who are addicted to smoking. Obviously, you can get nicotine patches, you can get Chantix and so forth from a regular doctor. We offer behavioral interventions as well. Cognitive behavioral therapy really helps for people to quit smoking. So the other issue with lung cancer is because it is so common and because it is so prevalent, sometimes people tend to undermine the importance. For example, related to something like breast cancer or colon cancer. A lot of people are more familiar with breast cancer because it's more prominent in the media and so forth. So there are two main types of lung cancer. One is small cell lung cancer. So I'll briefly start with non-small cell lung cancer. It's a type of cancer which is more. It has stage 1, which is limited to one part of the lung. We have stage 3A and stage 3B, where it can go to the other side of the lung, or it can expand into the pleural space, which is the space between the lung and the chest wall. So it can cause fluid accumulation there. And stage 4 is obviously a distant spread, where the cancer has spread beyond the chest area. So in early stages, stage 1 and so forth, we can do surgery, and in the later stages we can only do chemotherapy and radiation. So the most common chemotherapy is cisplatin-based medications. So those are platinum-based compounds that are offered to the oncologists. They're pretty good cure rates as long as the cancer is diagnosed early. So the same thing with the other type called small cell lung cancer. It is a very invasive type of cancer. Most of the times when people are diagnosed with small cell cancer, the cancer has already spread to distant organs. So there is a limited cancer where the cancer is limited only to one lung or one particular area of the lung. And there is a extensive cancer where it has spread to different parts of the body, especially the brain and so forth. No matter what the stage is, the treatment is chemotherapy or a combination of chemotherapy and radiation. And the most common chemotherapy drug is either etoposide or cisplatin. And those are offered through the oncologist's office. And radiation is actually to limit the extent of the disease. Like if the patient has a tumor going into the brain, they can offer radiation to that particular part of the brain. And the cure rates are not as good as non-small cell cancer, because the small cell cancer is much more aggressive in the nature of the disease. And at the end, I'm going to talk briefly about what are the treatments that are offered in my office compared to the regular oncologist office. We offer mistletoe therapy that's very prevalent in European countries. That has been shown both in prevention and also to help with treatment. We also offer high-dose vitamin C infusion, and this is well researched, and it has shown improvement for patients who are having active cancer and they are having a lot of side effects. It can help minimize the side effects and also help with healing from the cancer. And it has also been shown as a preventive therapy. So if you had cancer before and you're recovering and you're presently in remission, so the vitamin C treatment will help you in prevention. We call it secondary prevention, where your chance of getting the cancer again go down if you take it. So those are some of the treatments we offer. I also offer energy healing. I want to briefly discuss about lung cancer because this is the most common cancer. Feel free to comment below. If you want to reach us, call us at our office number. Thank you for listening to me. This is Dr. K signing off.